Everything we have is about the patients. It's about the future. This is about protecting each and everything that we have built up. And it's about even building an even stronger contract. Everything that we do is for the patient. Think of it as we are in Code Blue right now. Be ready to do your part. Be ready to make sure that we survive, that we live, that we thrive. I believe we can do this. I know we can do this.
In '95, Kaiser was financially in dire straits. There was the possibility that they would close hospitals. So we came together after '95, and that's when the partnership was born. It was born out of those difficult negotiations that we had in '95. We knew something had to change. Basically, it was a new start. It was a new jump start for us to go back to what we as a union wanted. We wanted to talk about the patients. We wanted good staffing. We wanted quality care. We wanted to sit on safety committees. And that has just made Kaiser turn around since '95.
I am a product of the Labor Management Partnership. We opened up the hospital together in partnership. We opened up Baldwin Park in 8 months. I mean, it took a lot of blood, sweat, and tears. Every decision that was made, whether it was equipment, who was hired, and then even putting together a schedule, we did it jointly.
I believe that the members coming in could see how we were efficient, how we were happy to work there, how we embraced them and brought them in and treated them like family. And that's because we worked together, so we had a sense of ownership of our department.
Last month I was out with a surgery. Bad thing with Kaiser is when you're out, there's no backfill. And this is in our national contract that these managers are supposed to have backfill. For if a person is out, there's some means, a per diem, or somebody's going to come in and take that patient. With Kaiser, there is none. You're out for a week and this is one of my pet peeves. I'm out and they just cancel your patients up, and when the patients try to call and reschedule, they say he's out, he's on vacation. So these patients are thinking that I'm just out vacationing, but I'm out with a surgery. I'm on disability. So to me, they kind of throw us under the bus sometimes because they're not following the national contract with backfill.
From where we were in partnership before to where we're at now, there's just been this slow erosion. And partnership isn't partnership anymore.
UNAC, from the very onset, was very patient-focused and always has maintained that legacy.
So when the employer says that we're paid above market, they're very correct. It's taken 40 years of blood, sweat, and tears for us to get to this point. But let's be very clear when we say the employer has benefited from all the changes that we've made. Through the partnership, they've been able to provide above market care. So when they say that they want to change the pay in different markets, all that's really going to do is shift the good workers to the higher paid market. What happens is that you lose the good nurses, you lose the good physical therapists, you lose the good pharmacists, and our patients deserve more than that.
To win a good contract, we need to band together. We need to stay united. We need to listen to each other's needs. And there are times that a specific solution may not be best for me personally, but is for the greater good. And we need to make sure that we are looking at the greater good for all our fellow members in order to best serve our patients. I think we need to remember our ultimate goal is to provide tremendous service to our members, to our patients. And in order to do that, we need to stay strong, stay united.
So we need to stick together and not let the employer divide us. Because in order for us to provide the best care, we need the best pay and the best wages. And UNAC UACP will not stand by and allow the employer to jeopardize patient care when searching for profits.
The lives of our patients and the health of our communities are dependent on the outcome of these negotiations.